Hi, these cards were compiled to facilitate working through the MCAT style passage, Health After Trauma Related Correlates of Post Traumatic Stress Disorder. All right, and this is something that people might not be aware of, inmates coming home from war, or just people who we encounter on a daily basis because of the dynamics and different events that happen in a lot of people's lives. A lot of people are suffering from, mild or intense post-traumatic stress disorder. So it's just good to be mindful of others because we never know what they may have experienced. The H-S is associated with maintenance of homeostasis and hormone control. So what organ is associated with this? That would be the hypothalamus, which is just this little peanut structure right here out in front of the midbrain. And here we can see it's enlarged. It's color coded in green, and the anatomy is labeled. And we can see its positioning in relation. Well, actually, I pointed to the pituitary. The hypothalamus is above the pituitary. I'm sorry. But we can see its location with regard to the pituitary gland because it interacts with this gland, releasing certain chemicals to prompt it to go to work. Okay? The H-S is associated with memory. So which brain structure is associated with memory? That would be the hippocampus. Okay, so the hippocampus, the structure color-coded in red, is associated with memory. And it's just a sagittal view, like a side view, if the brain were cut in half. The C-M is associated with voluntary movement, balance, and coordination. So what brain structure is associated with these functions? And I'll give you a hint because a lot of these things are like messed up when you get drunk. So what brain structure is affected when you get drunk? And that would be the cerebellum. It's highlighted here in red on a sagittal slice. And here in a dorsal view, a coronal slice. Okay. Actually, this is a frontal view. The A is considered the brain center for emotion. So what brain structure is considered the center for emotion? That would be the amygdala, okay? So it is on a sagittal view, and then on a frontal view, you can see both amygdala on the left and right sides of the brain. Well, they're actually embedded within, so just keep that in mind. Okay. In the context of operant conditioning, positive refers to adding or removing a stimulus. So does positive refer to adding or removing? That would be adding. So you can either add a punishment stimulus or a reinforcement stimulus. Okay? In the context of operant conditioning, negative refers to adding or removing a stimulus. So which one is it? That would be removing. Okay? So you can remove a stimulus in terms of reinforcement, or you can remove a stimulus like a toy for punishment. In the context of operant conditioning, reinforcement refers to decrease or increase frequency of behavior. So which one is it? That would be increase frequency of a behavior. Okay? In the context of operant conditioning, punishment refers to decrease or increase frequency of a behavior. So what is punishment? That would be decrease frequency of behavior. So here we see punishment occurring in this photo as well as here.